All right, let's dive into healthcare today. Specifically, we're headed to Manipur in northeast India. Beautiful, but oh boy, when it comes to healthcare, it's definitely got its challenges.
Yeah, Manipur really highlights some of the biggest issues facing healthcare in India as a whole. It's got the same three-tier structure as the rest of the country. Tertiary, district, primary care, aiming to provide a safety net for everybody. But then you add in the terrain.
Yeah, the mountains, gorgeous, but I bet it makes things a lot tougher when it comes to actually building hospitals and clinics and like getting medicine to everyone who needs it.
Oh, absolutely. I mean, compared to flatter regions, and you see the difference right away, like, say you need specialized care, you're probably going to have to travel to Imphal, the capital, where the main hospitals are, JNIMS and RIMS, for instance. But if you're in one of the more remote villages up in the hill districts, that journey could take days.
So what's being done to help the people who can't just like walk down the street to see a doctor?
Well, the Manipur government's been trying a few things. They've got a couple of health insurance schemes, CMHT and Ayushman Bharat, to try and ease the financial burden. CMHT provides 2 lakh per family. And Ayushman Bharat, that one goes up to 5 lakh.
Okay, that sounds good on the surface, but is that really enough in a place like Manipur? I mean, with travel costs and everything else, especially if you have a chronic illness, those numbers could get eaten up pretty fast, right?
You're spot on. You're right. Those amounts can disappear quickly with a serious illness. Like, imagine needing long-term cancer treatment or a complicated surgery. Suddenly, that money doesn't go as far. It really makes you realize that insurance is important, but it's just one piece of the puzzle.
So it's kind of a multi-pronged approach then. I did read that they're also trying to expand medical education as well.
Exactly. Right now, there are 2 medical colleges, JNIMS and RIMS, the ones we were talking about before, but the government's realized they need more trained professionals on the ground. So they're pushing to create more nursing and paramedical institutes.
Makes a lot of sense. But I'm curious, are there like health challenges that are specific to Manipur that they're trying to address?
Oh, definitely. One thing they're seeing is a rise in cancer, diabetes, and hypertension, which, a lot of that can be tied to lifestyle changes and just a general lack of awareness, particularly out in the rural areas.
And that really underscores the need for more medical professionals, right?
Yeah.
Early detection and prevention could make a huge difference.
Yeah.
Are there specific programs they're putting in place to combat those diseases?
They're working on disease control programs to encourage healthier lifestyles and to increase early screening. And there's also a brand new state cancer institute being built at JMs. That should really bolster specialized cancer care in the region.
Well, that's good to hear. Now, what about maternal and child health? I imagine that getting expectant mothers to a hospital to give birth must be a pretty big challenge in those mountainous areas.
Absolutely. They've implemented national programs like Mission Indranluj, which focuses on vaccinations, and Janani Suraksha Yojana, encouraging women to give birth in hospitals rather than at home.
I mean, I can see why that's a hard sell when the closest hospital could be a day's journey away. Are those programs having any impact?
They are making some progress, but honestly, with the limited access to facilities, home births are still fairly common, especially in the more rural areas. Which brings us back to that fundamental challenge. How do you reach people who are essentially cut off from the healthcare system by mountains? And it can't just be about building more hospitals, right?
So what are they doing? I mean, are we talking like helicopters, airlifting patients?
Not quite helicopters, but it's an interesting idea. They've got these mobile medical units, or MMUs. Think of them like doctors' offices on wheels, going out to those remote villages and providing basic healthcare, checkups, vaccinations, even some emergency care.
Hold on. Doctor trucks driving around Manipur. That's pretty incredible. I bet those MMUs are a welcome sight for those villagers. But it sounds like even with those mobile clinics, there are still some pretty big obstacles to overcome.
You're absolutely right. There are hurdles, and some of them are, well, pretty tough to get past. And we've just started to scratch the surface of how complex healthcare in Manipur really is.
So we've talked about some of the good stuff, the government programs, the mobile clinics, but I have a feeling those mountains aren't the only problem. Like, what are some of the other things that make it hard to make sure everyone has access to healthcare?
Well, just building anything in those mountains is a huge challenge. Think about it, just getting the materials there, construction supplies, medical supplies. It's a logistical headache.
Yeah, no next day delivery for a new hospital wing, right?
Definitely not. And even if you do manage to build something, then you have to get the patients there. And a lot of these villages don't have proper roads. So ambulance service can be, well, iffy at best. Imagine being really sick, needing help fast, and the ambulance can't even reach you. Maybe a monsoon washed out the road.
That's a scary thought.
Yeah.
Really makes you realize how lucky some of us are to be able to just hop in the car and go to the doctor.
It's definitely a different reality for a lot of people in Manipur. And then even if you get to a hospital, you might run into another problem. There's a real shortage of specialists and medical staff in general.
Right, that whole brain drain thing. Makes sense that most doctors would rather be in Imphal where the facilities are better
Uh-huh.
and probably more opportunities.
Exactly.
But you know what I wonder about? The doctors themselves. I mean, I bet it's not always about the money. Why wouldn't more doctors want to work in these rural areas? Is it like isolation, lack of support? Maybe they're even worried about safety?
All of those are factors, definitely. It's not just about the salary. It's about feeling valued, supported, and safe. I mean, doctors might feel like if they go to a rural area, their career will stall, or that the living conditions will be tough.
It sounds like just throwing more money at the problem isn't going to fix it. You need to make doctors feel good about working in rural Manipur. But what about the people who do make that journey to Imphal for specialized care? What are those hospitals like? I'm guessing they're pretty crowded.
Oh, for sure. Hospitals like Janium's and RIMS are constantly getting patients coming in from the hill districts. They just can't get the care they need anywhere else.
So it's like a domino effect. The lack of good healthcare in rural areas just puts more strain on the hospitals in the cities. And that makes those programs to help the rural areas even more important. But we've been focused on the government. What about private healthcare providers? Are they doing anything?
They are, but it's pretty limited. Most of the private hospitals and clinics, they're all in Imphal, so the other districts are pretty much on their own.
Why is that, I wonder? Is it just that private investors don't think they can make money in those less populated areas?
There's more to it than that. I mean, operating costs are high. It's hard to find qualified doctors who want to work outside of Imphal, and the government hasn't really provided many incentives for private investment in rural healthcare.
It's like a catch-22 then. Investors don't want to build because there's no infrastructure or workforce. But you can't get those things without investment. So how do you break out of that?
That's the big question, isn't it? And it's something policymakers are trying to figure out. But it's not impossible. There are some new models popping up that could really make a difference in Manipur.
All right, you've got me hooked. What are these new models that could, like, revolutionize healthcare in Manipur? You mentioned something about public-private partnerships. What are those exactly?
Yeah, so public-private partnerships, or PPPs, they're gaining some traction. It's basically combining the strengths of the government, their commitment to public health with what the private sector does well, efficiency and innovation.
I can already see where this is going. Does this mean we could see, like, private diagnostic centers being set up in those district hospitals?
Yeah.
That would be a game changer for people who can't just travel to Imphal every time they need a simple blood test.
Exactly. Imagine a network of diagnostic centers all across Manipur equipped with the latest technology. People could get tested locally, and the results could be zapped over to specialists in Imphal, or even other major cities.
That would be amazing. But we still haven't solved that specialist shortage, have we? We can't just, like, snap our fingers and create more doctors, especially ones who are willing to work in rural areas.
No, definitely not. And that's where telemedicine comes in. This is another area where PPPs can be really effective. Think about it. A specialist in Imphal could consult with a patient in a remote village using video conferencing. They could even use AI to analyze medical images remotely.
Wow. So like a virtual house call from a specialist. That's pretty cool. But wouldn't that require a pretty huge investment in internet access?
It would, no question. But it's an investment worth considering. Think of it as building a different kind of infrastructure, a digital highway to connect people with the healthcare they need. And it's not just about doctors and patients either. PPPs could also focus on training healthcare workers in those rural areas, give them the skills to handle the more common conditions, maybe even some emergencies.
So it's not just about bringing in outside help. It's about giving those communities the tools to help themselves. I like that.
Right. It's got to be sustainable, long term. And there's another thing we haven't even talked about yet, corporate social responsibility. What if a big corporate hospital in, say, Mumbai or Delhi decided to, adopt a government hospital in a remote part of Manipur?
That's an interesting idea. How would that work exactly?
Well, they can help with funding for new equipment or provide training for the local staff. They could even send some of their doctors out there for a few weeks at a time to share their expertise. It's good for the corporate hospital, shows they care, and it's obviously good for the rural community.
So it sounds like PPPs could really address some of those big problems we've been talking about.
Yeah.
But let's be realistic. It's not going to be easy, right? I mean, there's got to be some downsides to these partnerships.
You're definitely right. PPPs aren't perfect. One thing is making sure everything is transparent, the contracts, setting goals that everyone can agree on. And then there's all the government regulations to deal with. It takes real commitment from everyone involved to make it work.
Wow, this has been fascinating. We started out talking about the unique challenges of healthcare in Manipur, and those mountains really do create some hurdles. But we've also learned about some really innovative solutions that are being tried out there. It's giving me a lot of hope. What do you think is the main takeaway from all of this?
For me, it's the fact that even though there are all these challenges, people in Manipur are coming up with creative solutions. They're not giving up. They're determined to make healthcare better for everyone. And that takes collaboration, thinking outside the box, and a willingness to, try new things.
And who knows, maybe what they're doing in Manipur could be an example for other places around the world that have similar challenges. Maybe they can teach others how to provide healthcare to everyone, no matter where they live.
It's a pretty amazing thought, isn't it? That even in the most difficult circumstances, you can still make a difference.
Well, that brings us to the end of our deep dive into healthcare in Manipur. But hopefully, it's just the start of your journey. Keep learning. Maybe even share what you've learned with others. And thanks for joining us.